The topic my group and I are covering is the prevalence of hepatitis A among children in Africa from 2009 till now. My name is Jessica and the rest of my group consists of Oswari, Gina, Matthew, Melissa, and Celine. To reduce the risk of catching and spreading hepatitis A, there are several steps that one can take to protect themselves and others from it. Improved sanitation, food safety, and vaccines are the most effective ways to fight hepatitis A. Always wash your hands after using the restroom and when you come in contact with an infected person's blood, stools, or other bodily fluid. People are constantly touching their faces and the bacteria and germs can easily enter through the mouth, eyes, and nose. Germs can be transferred to objects and then to another person when they have contact with it. They can be transferred into food, so it is best to avoid unclean food and water. Take the following precaution. Avoid raw or undercooked meat and fish. Do not buy food from street vendors. Heated foods should be hot to the touch and eaten right away. And beware of sliced fruit that may be washed in contaminated water. Washing your hands with soap will eliminate all the germs and bacteria. There are also hepatitis A vaccine shots that can be taken to protect oneself from the disease. The hepatitis A vaccine can protect you for 1 month after the first shot. To have a long-term protection against it, you would need to get 2 shots at 6 and 12 months. The graph on the right shows the incidence of hepatitis A. Hepatitis A rates have been declining since vaccination initiation in 1996 and since 1998 have been at historically low levels. The last increase in cases occurred from 1994 to 1995. People who are at higher risk for hepatitis A and should receive the vaccine include those who use recreational drugs, healthcare and laboratory workers who may come in contact with the virus, people who have chronic liver disease, men who have sex with other men, and caretakers in daycare centers, long-term nursing homes, and other facilities. By taking these measures, you can ensure yourself that you are getting the best treatment prevention from hepatitis A.
Hi guys, so my name is Celine and I will be talking to you guys about the extent of the problem, which involves the morbidity, mortality, and economic impact. So first I will be talking about the morbidity of hepatitis A. So morbidity is the condition of being ill, diseased, or unhealthy. So there are 1.4 million cases of hepatitis A annually and the majority are found in less developed countries. Some of the highest prevalence of HIV is seen in sub-Saharan African countries, and nearly all of the populations that are affected develop some sort of immunity. In young children younger than the age of 6, 70% of infections are asymptomatic with no long-term consequences. The infections usually last for periods of times and often get resolved within a few weeks unless the individual gets infected with another disease. So for mortality, it is the deaths due to the illness. Hepatitis A is more detrimental when found in older individuals. The majority of hepatitis A patients make full recoveries, and it is estimated that the mortality rate is 0.1% for children less than 15 years old, according to the World Health Organization. The World Health Organization also states that for every one case, every 1,000 children developed very serious cases of hepatitis A, which have about a 30% mortality rate. So for the next topic, it is about the economic impact. So hepatitis A can last for several weeks and it affects an individual's productivity economically and socially in the community. So it may take a while before the individual is able to go back to his or her day-to-day activities with helping their family or going to work. And hepatitis A is found in poor water quality and food establishments, which will take a lot of effort and technological advances to remove the virus. In 2016, the World Health Organization released a statement that aimed to eliminate viral hepatitis, reduce new viral infections by 90%, and reduce deaths to viral hepatitis by 65% by 2030. So this action plan is estimated to cost around 3.8 billion South African rands, which is about 294 million US dollars over the time period of 2017 to 2021, with its main focus on hepatitis B and C. So next I will be talking about the agent of disease. So hepatitis A is a viral disease that is primarily transmitted from person to person via the fecal-oral route. It's associated with contaminated food and water, poor hygiene and sanitation, and this virus replicates in the liver and is excreted into bile. So the cellular immune response to the virus leads to the damage of hepatocytes, which leads to symptoms and signs of hepatitis A. So it's usually not fatal, and hepatitis A can be diagnosed through blood work and antibodies in the blood. So this chart here indicates the events in hepatitis A and the infection. So HAV IgM antibodies indicate active infection, and the HAV IgG indicates recovery or vaccination in the past. So the IgM is represented by the larger red lines, and the IgG is indicated by the red dots. So as we can see, when the infection starts, it starts at week 0, and it go at week 2. That's when you start showing signs and symptoms, because between week 0 and week 2, that's the incubation period with no signs, and it goes all the way until week 4, which is when you absolutely see the signs, and then from week 4 to week 8, that's when the virus is being controlled, and you can see that the IgM antibodies began to go down, because as it goes down, the IgM antibodies indicate active infection, but as it goes down, that means the infection is getting lesser, and then the IgG indicates recovery or some sort of vaccination, so you can see that going up. So this chart is able to provide a visual representation of the events that lead up to being diagnosed with hepatitis A and what occurs approximately at each week.
Condition and clinical symptoms. Hepatitis A is a contagious liver infection that is caused by the hepatitis A virus. According to Mayo Clinic, it causes inflammation and affects the liver's ability to function. Not everyone that has hepatitis A shows symptoms. However, if one does show symptoms, they include fatigue, sudden nausea and vomiting, fever, loss of appetite, abdominal pain or discomfort, joint pain, jaundice, and or itching. Now, the image here that I have on the slide is from the Indiana State Department of Health, and it also states that infections in children are not usually accompanied by symptoms. Hepatitis A symptoms will usually appear 2 to 6 weeks after an individual has been infected. These symptoms may be relatively mild and go away in a few weeks. Sometimes, however, the hepatitis A infection results in severe illness that lasts up to 6 months. Modes of transmission. Humans and primates are the virus's exclusive natural hosts, making it highly contagious. According to the Centers for Disease Control and Prevention, a host is a person or other living organism that can be infected by an infectious agent under natural conditions. According to Mayo Clinic, the hepatitis A virus is most commonly spread through eating or drinking something that has been contaminated with fecal matter. Some specific ways include eating food handled by someone with the virus who doesn't thoroughly wash their hands after using the toilet, drinking contaminated water, eating raw fish from water polluted with sewage, being in close contact with someone that is infected with the virus, and having sex with someone who is infected. Luckily, the virus does not cause long-term damage and it does not become chronic.
Host factor is an intrinsic factor such as age, race, and sex, which influences an individual's exposure, susceptibility, or response to a causative agent, according to the United States Department of Health and Human Services. Regardless of age, gender, and sex, anyone can be affected by hepatitis A. However, some groups are more vulnerable than others. Children under the age of 10 and adults over the age of 65 are more at risk for hepatitis A and complications due to hepatitis A, such as liver disease. And the main reason is that children under the age of 10 and adults over the age of 65 have a weaker immune system than normal individuals, so they're less likely to fight off the disease. Race-wise, Asian Pacific Islanders are more vulnerable to hepatitis A compared to other racial and ethnic groups. And gay men who engage in sexual activities with other men are more likely to be vulnerable to hepatitis A than other sexual groups. And the reason is that hepatitis A is spread through fecal matter. Therefore, anal sex has the highest risk for hepatitis A. And here's a little line graph showing the incidence of hepatitis A by race and ethnicity. So as you could see, the Asian Pacific Islanders have the highest rate for hepatitis A, and I think it's kind of funny that they start off being the lowest in 2001, but as time progresses by 2016, they are the highest. They have the highest numbers of incidents of hepatitis A compared to other ethnic and racial groups. Environmental factor is factors such as geology, climate, and health services which can affect the agent and opportunity for exposure. Developing countries have the highest rates for hepatitis A, mainly because of their poor sanitation conditions and hygienic practices. Sanitation conditions means something like the type of water that they use and drink, as these type of waters are often contaminated with hepatitis A and other disease. For hygienic practices, developing countries have less knowledge about hygiene, such as washing their hands. As for religion, Protestant Christianity has the highest rates for hepatitis A because of their refusal of vaccination, as they see vaccination as an interfering with divine providence, and individuals who are not vaccinated are more at risk for hepatitis A.
So regarding the topic of temporal variation, hepatitis A has no seasonal patterns pointing to where and when a person is able to contract hepatitis A. However, there are multiple pieces of evidence that point to the liver disease being the most contracted during the summer and spring seasons. Studies have pointed that the disease most commonly peaked around endemic areas that are related to swimming, poor hygiene, and places that do not practice clean sanitary protocols. Some cases were found to have linked family members who did not practice thorough hygiene to be the cause of some cases of hepatitis A. So looking at the chart on the right, we can obviously see that the cases have increased during the spring and summer seasons, and during the winter seasons and fall seasons where it's colder, it dramatically goes down. Moving forward with the topics and gaps of knowledge, we can find that there are a few gaps in knowledge regarding the topic of transmission of Hep A, including how the question of definite seasonal trends of Hep A was not answered. There are multiple pieces of evidence pointing to Hep A being most commonly transferred in the spring and summer seasons. However, there is also recorded data that shows Hep A can be transferred in other seasons, even though not much data is recorded during seasons other than the summer and spring. So reviewing the chart in the previous slide, we can see that most cases were contracted during the spring and summer season. This can be said because spring and summer season is more hot, thus people use the swimming pool more. Pool usage cannot be determined as the main cause of Hep A. The main cause of Hep A can be determined as unsanitary protocols leading to dirty pools.
Further epidemiological research. Further epidemiological research should include an increase of hygienic practices in developing countries to decrease the spread of hepatitis A. Proper hygienic practices should include frequent hand washing, face washing, and bathing with soap and water. This is difficult to do in developing countries due to lack of resources. In order to provide these developing countries the resources to practice good hygiene, epidemiologists should study easier methods to achieve this. Providing developing countries clean/safe water is very difficult given the way that they live. This presents a need for water filtration or other forms of maintaining water clean, such as water storage. Further research should be done to develop alternatives for clean water, such as stronger hand sanitizers or other forms of eliminating bacteria. The need for an increase in health education is also vital for an increase in healthy hygienic practices. More research should be done on providing developing countries with better access to the hepatitis A vaccine. According to the World Health Organization 2018, vaccination efforts should be included alongside health education for sanitation and hygiene practices. According to PATH 2015, studies should also include accelerating research and development of these vaccines, along with how to make them more cost-effective. Research should also go into keeping vaccines viable for longer periods of time, as well as how to store them and transport them effectively. $100 million. Challenges facing vaccine availability comes from poor donor funding. This causes manufacturers to decrease their investments in additional production of vaccines. This increases the price of vaccines and results in more shortages. This is why we would use our money to increase funding. The need for immunization programs is very crucial in the developing world. They save the lives of 3.5 million children a year. Although these numbers are high, approximately 1.5 million children die from vaccine-preventable illnesses. If we had $100 million, we could invest in mass production of vaccines, and we could develop larger immunization programs. This could help a lot of children in the developing world. The money could also be used to increase the amount of health education programs aimed at proper hygienic practices, along with providing them with safe water. We would also use this money to invest in alternatives for safe water.